Welcome to the office.
Hi.
Hi.
Happy Saturday.
Happy Saturday.
Welcome to the office.
Thank you.
What brings you here?
I have lower back pain.
Okay.
Well, mid back pain and upper and neck.
The whole spine.
The whole spine.
Okay, so where do we want to start? Let's start with the low back.
The low back.
When did this start?
I want to say I started around 8 or 10.
When you were 8 years old?
When I was
10
8
years
or
old?
10. I was trying to think back to what age I was, and I want to say it's probably around 8 to 10.
What, did something happen back then?
I'm not sure, but all I could say is that we had a 2-story house and we had stairs, so I'm thinking maybe it's a possibility that I could have fallen.
You have siblings?
I have siblings. It's 4 of us.
4 of you?
Yes.
Then there's a possibility. Okay. All right, so low back started, you remember, when you were 8. You're fast forward many years now.
Many years.
And what have you been doing for it? Like, where are you at right now? How did you find me?
I found you on YouTube.
Okay.
And I've been following you for, I want to say, 6 years.
Oh, wow. I appreciate that.
Yes.
Thank you. Okay. So you know how I am?
Yes.
Okay. That's cool. All right. So you started watching 6 years ago. You know you have back stuff going on. Mm-hmm. Why now?
It's getting worse. After having my babies, I have 2 babies, and I had them back to back. They're 10 months apart.
Okay.
And after having my last baby, well, actually, the day before having my C-section, I went to a chiropractor because I couldn't handle the pain anymore.
Okay.
Once I had the baby, he told me take 3 or 4 months off. Once you get healed up, come back. I continued going for a couple sessions here and there. It helped, but it was only temporary. So then I just...
Did you have x-rays taken after pregnancy? So you don't even know what's going on in the body?
No.
So you had some adjustments after pregnancy. You got a little bit of temporary relief. And now you're here.
Yes.
Okay. And what makes the low back feel better?
Tylenol.
Tylenol.
And ibuprofen.
How long have you been taking that for?
For 3 months.
3 months every day?
Pretty much.
How's your stomach doing?
There's some days where I know it's not good to take it often, so I switch to ibuprofen.
How's your stomach doing?
I have some pain.
It's off, right?
Yeah.
A little bit from...
Yes.
And was it off before the Excedrin and the Tylenol ibuprofen, or it started during this time?
It was probably a little off, but now taking the Tylenol and everything, it's a lot more off.
Okay, so there's good information there I'd like to share. So anyone that tells me that Tylenol or Nsaids makes their pain feel better, they need to change the oils in their diet. And there's a chart I'll post up at some point. It goes through what we call the prostaglandin pathway. There's PG1, 2, and 3. They cause inflammation in the body. I'm just going to roughly speak. Okay, I know a lot of this is over a lot of people. It's okay. It's just, and you can look this up. So there are what are called inflammatory mediators in the body, prostaglandins, PG1, 2, and 3. Just know 1 and 3 are the good, 2 is the bad. 1 and 3 come from the good oils, the salmon oils, the krill oil, the flaxseed, the borage, the evening primrose, all that kind of stuff. The PG2 comes from the milk or dairy, shellfish, red meats, things like that. PG2 comes from what's called arachidonic acid. Arachidonic acid is what causes that tissue inflammation and pain. So if someone tells me, now here's the point of it, Nsaids will block all 3 pathways. So yes, it will reduce the pain, but it reduces it by blocking PG1, 2, and 3. So not only did you block the good, but you also blocked the bad. So instead of trying to block it, and we know we have a lot of PG2, let's increase PG1 and 3 by adding good oils into the diet. Make sense? And it's really, really important because, and I've had a lot of patients where they come in with a lot of different mechanical issues. And we fix the mechanical issues. There's no pressure in the spine, but then they're like, I still have pain. And that's where we have to look at inflammation and the things that cause inflammation, number one, and the things that reduce it. So going back to the PG1, 2, 3 pathway, if we want to bring down, we want to increase 1 and 3 and obviously reduce 2. So we add more of the 1 and 3s to the diet, right? The things that make 1 and 3 and reduce the stuff that causes the 2, which is the shellfish, red meat, dairy, things like that, okay? Cool?
Yes.
All right, what else? So that's the low back. And I
That's
just
the low
wanted
back.
to explain that, and I think it's really important because a lot of times people think it's not just an adjustment, it's lifestyle change, it's diet changes, it's movement, it's all of that. We're going to go over. Okay, what else?
And then moving up to mid back pain. Since I would complain about my back pain, my mom started taking me to kind of like, I don't know if you heard in Spanish, sobadores. Yes.
Sobadores, yeah.
She started taking me when I was young. I guess that was her way of finding help for me.
Okay.
So I remember she took me to one in a specific, and I remember that after they did like an adjustment, I felt like a pinch in the, like where my bra strap is at.
Okay.
And that's the one that bothers me, I want to say, the most.
And you're still feeling it how many years later?
Probably was like 12 by then, so I'm 35
Oh, wow.
now.
Okay.
So for years.
So you're dealing with this too long.
Yes.
Okay, what about the neck?
The neck, I think it's just bad posture, honestly, from the whole pain from the lower and the mid pain.
Okay.
That I don't think I know I don't have good posture.
Okay. You ready to let it go?
Yes.
You're holding a lot of stuff.
Yes.
You know that.
Yes. That it's even my foot now. It's just, I just know it's getting worse.
Okay. What else? So we know we have spine, we have low back, mid back, neck, left foot, or both?
Both hurt, but today, like, I would say my left.
But it can switch.
I could switch. Yeah.
Okay. Today's left. Okay.
Yes.
Anything else I need to know?
My knees.
Both
my
knees?
That's recent.
Okay.
Yes.
Right.
And then my wrist.
Both wrists. You had surgery on that right arm?
Yes,
What
I
happened?
broke it.
Broke what?
I broke my
Ulna?
ulna and femur.
Doing what?
Radius.
Radius.
My radius.
Femur's here.
Sorry,
good
my
shot.
radius. It's been years. This is probably 2009.
Fighting?
No, I wish. No, car accident.
Oh.
And I broke it. They were gonna cast it originally, but then they seen that it wasn't gonna heal, so they decided to do surgery. So that's why I have these scars.
Okay.
I have the metal plates and screws inside.
Oh, you do? Okay.
Yes.
And how's your strength and mobility overall?
It's good.
It's good, yeah?
But I do recently, my work that I do custodial work.
Okay.
They're using the repetitive.
Physical,
Yeah. I feel like I'm having pain in my right wrist.
All right, we got a few things to go over.
Yes.
Well, what I'd like to do is first go over your x-rays. And remember, you've watched me long enough, you know kind of how I am. And it's not just we're chasing all the pain symptoms.
No.
The pain is there or the symptoms are there because something is out of balance, the body is telling us, right?
Yes.
So the idea is let's figure out what's out of balance. What do we have to do to get it in balance?
Yes.
Second thing I wanted to point out with you and with everybody for that matter, you know, people come, I mean, we're very blessed. We have people coming from all over the world to see us.
Yes.
But they think that, you know, everything's getting fixed in 1 or 2 visits, and it's not.
It's not. It's been years.
You know, so the first thing is to figure out, get some answers. That's always my first objective. Let's get some answers. What's out of balance? Number 2, what do we need to get it back in balance? Number 3, how do you respond to the adjustment? Then we can figure out what's the fix or management.
Yes.
Make sense? Okay. You ready?
I'm ready.
Let's do it.
Been ready.
Let's do it. Come over here, please.
Yes.
So first thing is, when we're looking at the side profile, yes, we know there's 24 bones in the spine that move, 7 in the neck called cervicals, C1 through C7. 12 in the mid-back called thoracics, T1 through T12, 5 in the low back called lumbars, L1 through L5, and then we have the sacrum and the coccyx. And the sacrum is 5 bones from birth that fuse or ossify or mature by 32 to 35. Okay, so first thing we want to look at is our posture. When we're looking at our posture, we're going to run a posture line straight up. And when we look at this posture line, this line should go through the base of the neck here. It should go through here. And so what it's showing us, Madame, is that you carry the upper part of your building behind your foundation. So if this is the top of the building, the bottom, they should line up. This is behind. These muscles are working overtime. That's why you have all that tightness and stiffness and pain. Posture. Now, so that number 1 is posture. It's contributory to the problem. Number 2, let's look at our curvature. We should have 60-degree low back curve, 60-degree mid back curve, 40 to 60 forward cervical curve. So when we look here, what do we see here? Do we have the curve? Not really. So let's go down and let's zoom in and let's take a look at a few things. And the first thing that I'm actually getting is you have an old coccyx injury right there. Okay, so that's the first thing I see, number 1. Number 2, I see a disconnected S2 and S3. So we have tailbone work to do first, foundation work, okay? From there, let's look at the curvature and the discs and everything and what's happening here. So 5 and 4 are good, but then what happened to 3? 3 juts back. 2 goes with it, and instead of curving, it kind of just goes straight. You see what I'm talking about? It goes straight, and then it doesn't curve back. It's still straight. So this mid-back is a little bit further behind than we want it to, and so what is the upper body doing? It's compensating by creating that reverse curve, besides the injury that you have that I'll talk about. So if your neck was in the right curve, you'd be off balance. You'd be way back here. Make sense?
Yes.
Okay. Now, let's look at the discs. When we're looking at the disc spaces, it gives us a lot of information. We're looking at the disc spaces. The disc spaces, they're a little bit less than they should be, but they're still good. Okay? And if I'm looking 5, 4, 3, 2, 1, 1 starts to get, 12 starts to get a little bit thinner. But overall, the discs are good. These are good. Now, when we're looking here, you can see a little lipping of the bone. That's because there's a lot of weight being put on that part of the spine. And I'm assuming there's a lot of flexion. There's a lot of this type of movement. Now, as we go up the spine, what do we see? These discs are all good, by the way, okay? This injury you had in your neck was at least 20 years ago. This is an old whiplash. And if we look at the shape of these bones are all good. You see this bone, it's kind of squished. You see that? It's kind of squished, and you can see it's starting to form this little lipping here. Your disc is still good there. It's in a reverse curve. This is not the cause, it's a result. So we have to work on posture. First thing we'll talk about before we get started in posture is you should be sleeping on your back, 2 pillows under your knees, no pillow under your neck.
Okay.
If you're a side sleeper, then sleep on your right side is better for your low back and your mid back. Let's look at your foundation. And we know the foundation is off. We have a 6 millimeter lowered leg on the left. We have a rotated sacrum on the left, drop 4 millimeters. So we know there was a tailbone injury. That's where we have to start. We have to start on the sacrum, down low. Okay, maybe the coccyx and the sacrum. Now, from there, what you can see is that this is all compensating. It's dropping on the left side of the spine, creating this curve. The body immediately compensates to here, but then it does it again. Okay, so a lot of that is also habit. And if we're looking, all of this is compensation to your foundation.
The posture.
Okay?
Yeah.
All of it. Make sense? You ready to get started?
Yes.
Vamos.
I remember I had a sister who would tell me, "Why don't you sit right?" And I would tell her, "It hurts." I couldn't have, like, I wanted to sit right.
Yeah.
But it's just, I had pain when I was younger.
Well, let's get you sorted out then, okay?
Yes.
Vamos. And let's take a look and see what's going on. So, first thing we're going to do is run the meter on the spine, starting at the base of the neck. Number 6. C6, 5 points, right side. Maybe C7. There's a lot of inflammation in your body we're going to be talking about in upcoming visits too.
Yeah.
So, the way I see your case already right now, this is a foundation case and a digestion case. Get the foundation right, get you moving again, and then work on the digestion and inflammation.
Yes.
T5, T6, 10 points, left side. There it is. Ba-da-da-da. S5. S5, coccyx. T5, T6, C6, C7. Those are the areas we're going to start in. Static palpation. Running my fingers down the spine. 1, 2, 3, 4, 5. More tender when I push at 6 or 5. 6 or 7.
7.
That's the sugar button. 1, 2, 3.
Is that why you crave a lot of sugar?
That's the sugar button. T7.
I crave a lot of sugar.
Come back slowly towards me. 5. Número 5. Duele?
Right there.
Let's keep going. 1, 2, 3, 4. I'm starting down there. 5. You feel that? L5. I know that's tender. 1, tender. Come back. 2, tender. 3.
Yes.
See? 4. And 5. That's where we're starting. 6, S5. Sit back for me, please.
Okay.
Scoot your butt back a little bit, please. All right. And let's feel the neck. 7, 6. You feel the neck right now, right? Turn left. There's some there, but I'm going to do something different with you, okay?
Okay.
We're going to do that at the end. The way I'd like to work, we're going to start this way. We're going to do S5 and T6.
Okay.
I'm going to have you walk, recheck the neck, then decide if we're going to do it. After that, I'll work on your feet.
Okay.
And then we'll tune up your extremities.
Okay.
Can I have you stand up first and let's see you walk so we have something to compare?
Yes, sir.
And you're going to walk a straight line. Let me tuck the back of your gown in.
Okay.
This is your normal walk, correct?
Yes.
Cool. Just keep walking. Just keep walking. And you're working sitting at a desk?
No.
You're on your feet?
On my feet all day.
Okay.
Walking.
Keep going. You can see when she's walking, she's not very stable in her walk.
No, I can feel it myself.
Have a seat, please. You ready to let it go?
Yes.
Yeah? Vamos. Face down. Señor, come help me. Put the phone down. You're the husband, right? Come do some work, dude. Come on this side. Vamos. You like that mint, right? It's good.
Yeah, it's good.
Put your hands here like this. Light, light. Light, light. That's it. Light. Now, we need to torque that sacrum up on the left side in order to get that side up. Relax the shoulders, please. Bueno. That's the home run. Gracias. 4, 5, 6, 7. Perfecto. Poquito más. That's the rest. You ready? Step back for a minute. Hold my hand. March in place. March in place.
I hear my knees popping.
Okay, walk it out. Check it out.
Okay.
Now, as you're walking, let me open the back, please.
Yes. Mm-hmm.
Tell me if anything feels different yet.
I feel lighter.
Walk, please.
Lighter. And less wobbly.
More stable.
More stable.
And just walk regular.
Okay.
Walk regular so
Okay.
we have something to compare. Yeah, you're definitely walking with more stability. It's good.
I mean,
You
I
can see
still have
it in
a little bit, but it's not as bad as.
Absolutely. Have a seat. Let's
Okay.
continue. Let's check the neck and do the neck.
Mm-hmm.
I just want to test something out first. No, it's still there. Okay. Just checking. Center on the chair. Scoot to the right a little bit, please.
Okay.
And back. All the way back.
Mm-hmm.
Good. C6. Up. Nice. That was a good set. Stand up, walk it out, please.
Okay.
No cracky.
Yeah.
That was a set. Nice. Have a seat. Let's recheck everything.
Okay.
Bueno. C6 is clear. Mid-back is clear. Very nice. All clear. Check it out. Come back all the way. Come on. 5. 1, 2. Different.
Yes.
3.
Mm-hmm.
Different.
Yes.
4. This is the one I adjusted.
Mm-hmm.
What's different?
It hurts less.
All right. Let's continue.
Mm-hmm.
You ready for more?
Yes.
Go on your back, please. Let's work on your feet. Raise it up.
Oh.
Raise your left leg. Sound is the board.
Mm-hmm.
Sit up and turn. Now, I'm not doing the ankle or the knees today. I'm showing you from just what we're doing.
Mm-hmm.
Knees should start to get better, okay? We'll work on it as we need to.
Okay.
I'm going to reach over. Let me do the shoulder. Let me do the shoulder. Ears. Stand up. Let's walk again a few times.
Next me.
Yes. That should be more different.
Yes. Yeah.
Have a seat. Bueno. Now let's do the buff and polish. All right, walk it off last time and we'll do the hands.
Okay.
Good times.
I feel different.
Different? What's different?
Just even like the way I walk, it feels different. I don't know how to explain it. Just better.
Wrist? Stop fighting. Drop, drop. Relax the hand. Thank you. There you go. Squiz. Squiz. Okay, homework very simple. Walking 10,000 steps a day. Get yourself a yoga ball. Sit on the yoga ball, bouncing 5 minutes in the morning, 5 minutes at night. Okay. Practice sitting on it up to an hour a day. Questions?
No.
Welcome to the office.
Thank you so much.
You're welcome.